A very good evening. You're with Channel I, and this is IMID. Now, on IMID, we do usually talk about different kinds of diseases when it relates to the human body and the complications that comes along with it. So today we are going to touch on a topic which is quite, well, not quite controversial, but something very, very important in the recent times, and that would be about cancer. So to talk about cancer, we have an expert in our studios today to talk about this specific topic. We have with us consultant oncological surgeon Dr. Nayamal Pereira with us. A very good evening to you and welcome to the show, doctor.
Good evening.
And now, as you might know, might not know, we did celebrate World Cancer Day 2022 on the 4th of February, which is an annual event or an annual commemoration of the World Cancer Day, which is celebrated on the 4th of February. And the theme for this time was closing the care gap. Now, we will be talking about those in a much more deeper manner later on, but when we talk about anything, doctor, we have to define first what we are talking about, what we are getting ourselves into. So if you could actually define what is a cancer in a general sense.
Cancer is a change in the genetic composition of a cell, which can cause by many reasons, like maybe physical or chemical or biological. For example, if you say physical, it may be the radiation or maybe ultraviolet light coming from the sun. Then the chemical, the commonest one is the nicotine we find with tobacco, and there are a lot of chemicals involved in that. And the biological are caused by the viruses like hepatitis B. Then it could be there are sort of certain viruses which can give rise to sort of say even HIV. Those are the reasons for biological causes. So anyway, when the genetic composition is changed within a cell caused by one of these things, we can sort of see a couple of slides and then I'll be able to sort of explain. So say for example, if you get a physiological stimulation, then what you get is with multiplication you get a normal cell. But if there's something hazardous, maybe like smoking, then of course the genetic composition will alter the genetic pattern, and that will give rise to a cancer cell. In a cancer cell, the important thing that we have to remember is that when they keep on multiplying, there is no limit, there is no completion of the multiplication. Say normal cells, when they keep on multiplying, when the adjoining cell realize that there is hardly any space for it to multiply any further, they will say, okay, stop it, because we have multiplied enough. But if it is a cancer cell, this signal is not there, so it will keep on multiplying, and it will sort of grow over the normal cells. And when it is sort of grow into a huge lump, maybe when we talk about huge lump, it is even 1 centimeter lump is quite big. So when at that stage they will realize that the various nutrients or oxygen come into the center of that mass is not adequate, then they will start secreting certain chemicals which will promote blood vessels to grow into this. Then only one single cell can detach from the mass and get into a blood cell, and where it can spread. So basically, to sort of summarize the whole thing, it is cancer cell is a genetic alteration which occurs due to various stimulation, where it will not signal not to stop multiplying, and they will keep on multiplying and make a huge mass and destroying the low tissues around it, as well as it can spread into other organs and metastasize in other places as well.
So basically it's a mutation of a cell.
Correct.
So now if I ask you, what are the most commonest symptoms? Now when you say cancer, there are several types of cancer, yes, I get it, but what are the most common symptoms that you find in patients when you diagnose a cancer?
It all depends on the type of cancer as well, but the commonest is a lump which is growing quite fast. Fast in the sense it is not within 1 or 2 days, maybe say it might take even, if you consider the breast, it might grow within say matter of say 2 to 3 months. I mean, then you will realize that it is not the normal way it is. I mean, one myth or people believe is that when there's no pain, they believe it is not a cancer. It is wrong, because these lumps at the beginning do not cause any pain as such. So a painless lump anywhere is, I mean, if it is growing fast, should sort of alert the individual and should obtain medical advice immediately. Then bleeding from any side, or maybe say from with the stools, or maybe sort of coughing, or while they brush their teeth, if they realize there's some abnormal bleeding, those are could be a symptom of a cancer which is deep seated. Then if there are ulcers, that is commonly seen among on the surface, like on the skin, if there's a non-healing wound, or maybe inside the throat, if there's a painful, it can be a bit painful inside the mouth because the nerve cells get exposed, especially when there's an ulceration, the nerves get exposed, then of course they will have pain. Then if there is some continuous pain in the abdominal cavity, then of course you should sort of investigate quickly. So it all depends on now of course there are sort of when it is taking too long, they can lose weight and their appetite might go off, and sometimes they will have nauseated feelings, and certain cancers like the blood cancers might have a sort of a low grade fever going on for many weeks. So these are all the common symptoms that we see with cancers, but it again I have to emphasize that it all depends on the type of cancer.
And yes, that's an important message to you as well. And if we actually shift our attention towards the context of Sri Lanka and the cancer rate, if you could explain what is the most prevalent cancer and the cancers with regards to the human body in Sri Lanka.
Now in Sri Lanka, the various cancers we have seen it gradually changing, because what was done, although we think we are not developed enough, but anyway with regards to cancer, I think the cancer patterns are getting more westernized. We see more westernized cancers sort of gradually, the incidence wise they are sort of coming up. So the breast cancer is the commonest now. When we consider both males and females, breast cancer is the commonest. We can see even in the graph that breast cancer has been, say roughly we see about say 3,500 to 4,000 cases every year. And with this, altogether we see about 35,000 to 40,000 cases for a year in all the cancers. And these numbers, if you go through the statistics which have been released by the health ministry, we have seen the numbers getting doubled up every 20 years. So even in the world, it has been seen now at the moment, we see about 20 million cases of new for a year in the entire world. 20 million, so it's almost like the entire population of like Sri Lanka having cancer in the entire world. And they estimate that it could go up by 60% in another 20 years time. So by 2040 there will be almost about say 30 to 40 million new cases for a year.
Even though it should go down. Yeah,
but then with that was one of the main goals of the cancer world authorities this year at the World Cancer Day. That is to sort of, although the numbers goes up, they want to sort of reduce the death rates. So they have achieved actually with breast cancer, they have achieved to reduce the death rate in the developed countries.
And actually, doctor, talking about the steps that a patient should take when he or she is diagnosed with a cancer, what's your take on what he or she should do?
I like to sort of rephrase your question again. Rather than once is diagnosed, I would like to sort of take one step before that. I think all the people should sort of be aware. I think these type of programs, and they should read a lot about various cancers, and they should be aware. That is, the awareness is very important, because people...
talking about reading, doctor, I wanted to intervene. You have to read things which are scientifically proven.
Correct.
And scientifically based, rather than pinching on something you found on social media.
Correct. Because unfortunately, almost everyone, including probably, even me, we believe that I will not get a cancer. Another person might get, but I will not. And so we tend to not to take these diseases very seriously. So the awareness is the most important thing. And to not only to be aware of the disease, you have to sort of screen. And once it is screened, when you come to the question again, once it is diagnosed, that is the point where they should sort of go and sort of take treatment immediately. They should not sort of delay it. I mean, most of the time they think, okay, how can I get this lump? And it cannot be a cancer because I have done so much of good things in my life, right? And because of that I should not get a cancer, so I will just ignore. And probably they might say, okay, I will wait until I get some pain, I will wait. So these are all wrong guidelines, all not
misconceptions, you would say.
Yeah, so they should sort of immediately go and sort of get medical advice and investigate the disease and start treatment as soon as possible.
And now I'm about to move on to some about a topic which is very important, the societal stigma we have regarding and around based on cancer. So what's your take and what's your advice? What would you say to the stigma surrounding cancer?
This is very common in developing countries like Sri Lanka, where people tend to hide everything, and they don't want to sort of tell anyone because of certain things, like say for example they think, okay, I will not be able to sort of give my daughter in marriage because others might talk, or there's a patient who had cancer in that family, so they have very they are scared that the people will talk about it. I'll give one good example because about 20 years back, when I was in Apeksha Hospital working as a registrar, I did a study, and I wanted to get all the patients who have been treated during the last 2-3 years, and I had to send some letters to ask them to come and meet me. And when I posted, there were almost 400 letters I sent, and out of that almost about 300 letters got returned saying that it is a wrong address. Because one thing, then I had to sort of go and meet the director and have a discussion with him, and he said that is correct, because they don't want to reveal their true address, because then the story might go on, because as soon as they get a letter from cancer hospital asking them to come, all the neighbors, including the postman, will be talking about that particular family who have been affected by cancer. So this is the biggest issue. I think the people are trying to hide, and even say, especially when they have a cancer, they try to hide. But to tell you frankly, there are so many survivors in Sri Lanka who have survived this cancer, and they are living a normal life. Still they want to hide.
So basically, I mean, if those survivors, or people who have survived cancers, can step up and actually aware the general public, I think that would be a very good initiative, and from the doctor's perspective as well.
Yeah, it is actually, it's true. That is what we once did before this COVID hit Sri Lanka. We had a survivors program called Can Survive, and there we got all the cancer survivors to come and have a interactive meeting with some specialists. What we did was we advised them how to sort of change their lifestyle and their dietary habits, do regular exercises, their checkups, everything we have to sort of train them. And at the end, the main objective of our trust was to sort of get them out of this hidden shell and to tell it to the public, saying that there's nothing to worry, we are survivors. We survived because we picked up the disease at very early stage, and we followed the correct treatment protocols. We got it cured. So that is the message I want them to tell the public or the entire country. Don't hide your disease. Come out and go quickly and get the treatment done, and be like us, because we are survivors. So unfortunately, we don't have many survivor groups in Sri Lanka, but in developed countries, the survivor groups are there to help each other. They talk how they sort of recovered, how it has changed their lifestyle, and how they are sort of enjoying a normal life. So if we can do this, the people their myth about the disease will go off. I used to sort of tell always, cancer, word itself is a cancer, because it put the person, the psychologically they will make them negative. So we have to come out from that. That is the main reason why the Maharagama hospital name was changed to Apeksha, because there should be Apeksha, there should be some future. That is what they did.
I think that's a very good message to the general public out there who are currently suffering from cancer. And now, Dr. Cancer is not something that we discovered recently, right? So it's a very old disease. So I wanted to inquire from you, what are the new developments when we actually consider treating cancer? What are the new developments?
To tell you frankly, I think there are a lot of newer developments. I think mostly the breast cancer is the one which have been investigated and researched mostly, and it can be into so many aspects, even surgery, as me being a surgeon. Even in surgery there are a lot of newer techniques. So it is not what we used to hear those days, where the entire body was mutilated and so many organs were removed, and you don't need to sort of undergo that type of surgical procedures if you come early, because we have to remove only that small lump, and nothing will happen. There will be no disfiguration of your body. So there are a lot of newer developments. We tend to sort of cut lesser and less with the newer technology, and we don't need to sort of go into very radical type of surgeries. Not only that, even in the chemotherapy. Now I know most of the people, they say, I prefer to die with this cancer rather than undergo chemotherapy. No, that is wrong. That is because now the newer chemotherapy drugs are not very harmful like those days. I can remember those days, from the time they inject the chemotherapy, they start vomiting. Now it doesn't happen like that. I mean, there are people, I have seen so many females, they enjoy their life while they sort of be on chemotherapy. I mean, I have seen one lady, I had to sort of call and sort of tell her not to do that. I saw her had tuna on the beach. I mean, so because it is not that difficult to sort of take it. So these are the newer technologies, and also the radiation facilities and certain tablets which have come now, because these are all developed gradually, and with the newer technology, we don't need to sort of do any sort of very radical type of treatment procedures. And on top of that, the screening modalities have improved a lot as well. Now the newer mammographies, they can pick very, very early disease. So that is what the people should target. They should sort of think about screening. They should sort of go and pick it up when it is very, very early, because then you don't have to undergo very radical surgeries or get chemotherapy or radiation. You just remove that part, that is enough, because there are newer techniques to pick it up. So they have to initiate it, and they should go and sort of screen themselves.
And what do you say to people who self-diagnose themselves? If I may, there are so-called pundits, and what is your message to them? The self-diagnosis part, can a patient do that at their own homes, or should they actually receive medical care?
No, actually self-diagnosis is good in a way where they will be able to pick it up an early disease. But they cannot sort of definitely say this is a cancer or not, because it has to be sort of checked in the correct way. There are protocols, there are internationally accepted protocols, so we have to sort of follow them. Then only we will be able to sort of confirm the disease. So without confirming, they cannot sort of do it. And also some people, they self-diagnose, they assume, without diagnosing it, they assume that this is a cancer, because when they felt alarm, and they try to sort of treat themselves by sort of going into a pure herbal dietary regime, or maybe using certain herbal things, and try to sort of treat themselves. That is wrong, because I think it is better, first of all, to meet a doctor, because it is one way it is good that they have been able to pick it up, because some people, they tend to ignore, even if there is something, they tend to ignore. But if they pick it up, it is always good to sort of go and meet a doctor and get it confirmed and follow the accepted treatment protocols.
I think that was a good message to the public who are watching today's show as well. Now, I wanted to inquire from you, Doctor, are there any initiatives taken for cancer awareness among the general public with regards to you?
Yes, there are a lot of initiatives. Especially the World Cancer Control Program, that is called the UICC. They are doing, they are trying to sort of improve the standards. And to tell you frankly, it is they have realized that only about 25% of the world population, only 25% of cancer patients get the proper treatment, and the awareness wise they don't get it, the screening they don't get it, and the treatment protocol they don't get it. So it is only 25% get the best treatment in the world. So in Sri Lanka, I think the cancer control program is doing a very noble job. They sort of conduct various seminars, they publish various articles, they distribute leaflets, they conduct TV programs, they conduct radio programs. And during my 20 years experience, I have realized the awareness in Sri Lanka about cancers have improved a lot. It has improved a lot. It has to go some more further, but I would say it has improved a lot.
But so you would say the general public knows up to the extent they're supposed to know, or they have to know more? But because the general public can't know to the extent of the doctor, right? So they have to know up to an extent where there's this thin line, but they have to be balanced. They have to be able to self-diagnose themselves or actually know the symptoms. So where do you draw the line on that?
It is. I think they come up to the point where it is being diagnosed. I think most of the people they follow the correct guidelines. But the issue is, once it is diagnosed, there are a lot who go behind quacks to sort of get it treated because they think surgery or chemotherapy and radiation will harm them badly. They tend to sort of follow certain non-accepted treatment protocols which are freely available in Sri Lanka, which may be sometimes more expensive than the accepted world accepted protocols, and they tend to sort of follow them. So that is where we go wrong in Sri Lanka. That is why still we are not being able to reduce our death rates, because they go all over the place, and finally when it comes to the end, they try to sort of get treatment from us, and then it is too late. So the important thing is, and there are smaller percentage, when they know it is cancer, they think, okay, I'll just live with it because I might live, any day we have to die, and so they think, okay, I'll live for another 5 years or something like that and die. So that is wrong, because their survival we might be able to sort of improve by 10 years sometimes, or maybe 15 years. So it is always sort of good to have a very sort of a healthy life and enjoy it. Until you live in this world, we should sort of enjoy.
And I think that was a good message to the public. You have to just enjoy and live in an optimistic manner. That's a thing that you have to think about in your free time. And Doctor, now I want a brief answer for this question. What about the ayurvedic treatments? Because the in the Sri Lankan context, we tend to search solutions for cancer patients in Ayurvedic. Not only in cancer patients, we tend to turn to that side. What is your take on that?
I am a Western qualified physician, I'm a surgeon, and our system has been accepted worldwide. And we, all the consultants in this, I mean, the way we practice, it is not only we sort of train ourselves in Sri Lanka, we go overseas and we get ourselves trained in a westernized country where there is all sophisticated techniques, and that is what we sort of practice in Sri Lanka. But Ayurveda system is only confined to Sri Lanka, and it has not gone beyond. So there is a question mark why it has not gone beyond, and why it is not being accepted in other countries. I mean, if you Google it and say what treatment protocols are accepted worldwide by the WHO and various other international cancer control programs, you realize that it is only Western medicine has been accepted, because it has been researched properly and it is well accepted in all the countries. Everybody follows the same protocol, and when we do research, it is not confined to America. There is all multi-center research protocols. So if somebody wants to do some research on breast cancer on certain matter, then they don't sort of do it only in one country. They take at least about, say, 10 or 15 centers to sort of work together. So then we prepare a proper treatment protocol which is accepted for the entire world. So that is why the Ayurveda system has gone wrong, because it is still within our country, and I don't believe that it can sort of
It could have a significant
impact.
Okay, and with that we have to wind up today's segment, because we have come towards the latter part of the program. Thank you so much, Doctor, for being here in an attempt to educate the public about cancer and its related aspects today on Channel Eye. So with that we wind up today's segment. Again, thank you so much, Doctor, for being here. And yes, we wind up today's segment of iMed on Channel Eye. Do stay tuned to Channel Eye and tune in next week as well for another new disease, new episode on iMed. So until then, have a safe day ahead. Have a pleasant day ahead as well.